drug abusing, trouble developing close relationship, or having low self-esteem. Treatment for depression are treating depression is treated with psychological intervention like physical activity and socialization, psychosocial intervention like physical activity and socialization, or psychotherapy like cognitive behavioral therapy focus on the person's mood and behavior, and interpersonal therapy like exploration and behavioral change techniques, and as well it treats by medication like antidepressant medication. Nursing intervention, it is very important to support the major in the patient, in the client in this problem. In this case, so interact with the client in the low and firm tone, and encourage the client to verbalize his or her feeling. Be calm and support when the client shows irritable. Identify the client interest and prevent suicide and complication by helping the client feel that life is worth living. In general, this is what depression in the older adult. Thank you.
Good morning, everyone. My name is Vinette. Today, my topic is about anxiety disorders, mental health issues affecting elderly population. People with anxiety experience create significant distress and some degree of functional impairment in their daily living. A person with an anxiety disorder may find difficult to function in areas of life such as social interactions, family relationships, work, or school. Different anxiety disorders occur together or with other conditions such as depression or substance abuse. There are 6 main types of anxiety disorder. These are social anxiety disorder, post-traumatic disorder, panic disorder with or without agoraphobia, specific phobia disorder, obsessive-compulsive disorder, generalized anxiety disorder. Generalized anxiety disorder is characterized by persistent worry and associated physical symptoms lasting 6 months or longer, and the most common of the pervasive anxiety disorder in later life. The signs and symptoms include restlessness or feeling wound up or on edge, being easily fatigued, difficulty concentrating or having their minds go blank, irritability, muscle tension, difficulty controlling the worry, and sleep problems. What causes generalized anxiety disorders? Generalized anxiety disorders sometimes runs in families, but no one knows for sure, while some family members have it while others don't have. Several parts of the brain, as well as biological processes, play a key role in fear and anxiety. Researchers are also looking for ways in which stress and environmental factors play a role. According to Carolee Cassidy and Nell A. Rector, of the 5 anxiety disorders, 90% of late life anxiety presentation are accounted for by either generalized anxiety disorder or specific phobia, with generalized anxiety disorder representing at least 50% of cases among older adults. Generalized anxiety disorder is exhibited in the brain as increased metabolic activity in the occipital, temporal, and frontal lobes, and in the cerebellum and thalamus during passive activity. During vigilant activity, the basal ganglia are also involved. This is where the areas of the brain affected by generalized anxiety disorder. The treatment of generalized anxiety disorders are psychotherapy, which they call them cognitive behavioral activity therapy. Medications such as selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, other serotoninergic medication, and benzodiazepines. Some nursing interventions include monitor or client for depression, use appropriate interventions, and referral. Anxiety often accompanies or masks depression in elderly adults. Provide a protective and safe environment. Use consistent caregivers and maintain the accustomed environmental structure. Elderly clients tend to have more perceptual impairments and adapt to changes with more difficulty than younger clients, especially during illness. Observe for adverse changes if anxiety drugs are taken. Age renders clients more sensitive to both the clinical and toxic effects of many agents. Provide quiet environment with diversion. Excessive noise increases anxiety. Involvement in a quiet activity can be soothing to the elderly. Thank you for listening. Now I will give you the floor to Sherry for schizophrenia.
Hi, my name is Mary Carmel Angeles Bori, and I'm here to discuss about alcohol and substance abuse among elderly. First, what is alcohol? Alcohol is a depressant drug that slows down your body's central nervous system. In older adults do not drink as much as younger people, but they can still experience alcohol-related problems such as dependency. As people age, their metabolism slows and they generally have more health problems. They are also the population that uses the most medications such as prescription and over-the-counter drugs. As the body ages, changes occur in the kidneys, the liver, the cardiovascular system, and the brain. An older person who drinks the same amount as younger person will have a higher blood alcohol concentration. Alcohol dehydrogenase, a critical enzyme involved in the metabolism of alcohol by the liver, becomes less efficient over time. According to the 2012 Canadian Alcohol and Drug Use Monitoring Survey, of Canadians aged 65 and older, 72% drank alcohol and 79.3% of that population are men and 66.3% are women. What are the risk factors of alcoholism among elders? First, retirement, bereavement, and other losses in the social network, enabling attitudes and behaviors, chronic stress, family and personal history, education and income, protective factors. What are the patterns of alcoholism among elderlies? First are the early onset, in which it started before the age of 40, and the second one is late onset drinker, in which it happens after the age 40. What are the effects of alcoholism? There are two effects, which are short-term and long-term effects. Short-term includes intoxication, injury, violence, accidents, spousal abuse, suicide, alcohol toxicity, and worse, death. Second is long-term alcohol dependence, increased risk of several types of cancers, which are oral cancer, throat cancer, liver, breast, and digestive tract cancers, diabetes, cirrhosis, pancreatitis, low birth weight, and fetal alcohol spectrum disorder. Next is substance abuse. Canadian seniors accounted for between 20% and 40% of prescription medication use and 25% of over-the-counter drug use. Less than 1% of Canadian seniors report using illicit drugs. The prescription medication mostly common use are heart medication, blood pressure medication, pain relievers, and benzodiazepines. Approximately 20% of seniors use over-the-counter pain relievers in addition to their prescription medication pain relievers. Women are greater risk of becoming dependent on prescription medications. What are the patterns among the elderly patient in substance abuse? First is dependence, which includes the use of medication contrary to instructions, use of multiple medications resulting in adverse drug interactions. Second is drug interactions, and that lastly, misinformation. What are the psychiatric problems associated with alcohol and substance abuse? First is cognitive deficits, Korsakoff dementia, which associated with alcoholism, psychiatric conditions such as affective depressions, anxiety, and schizophrenia and personality disorders. Thank you.
Hi Joyce, my name is Sherry Marnes Peros and I'm going to report about schizophrenia and bipolar disorder. So I'm going to begin with the schizophrenia. Schizophrenia is a serious mental health that affects 1% of the world's population. It interferes with a person's ability to think clearly, manage emotions, make decisions, and impairs ability to function. Possible causes would include damage to brain and chemistry and structure. It could be hereditary or it could be caused by medical or environmental conditions. Most common symptoms would be the psychosis or what we call the hallucination or delusion. And four types: catatonic, disorganized, undifferentiated, and paranoid. So onset 75% develop between the ages of 16 and 40. Late onset ages 45 and 65, and the very late onset older than 65 years old. Women have later onset than men because of the presence of estrogen, which may play a role in preventing schizophrenia in early life. Protection disappears after menopause. Symptoms would include positive symptoms like hallucination, delusion. Negative symptoms would include emotional flatness or lack of expressiveness, lack of pleasure or interest in life. The very common cognitive symptoms would include anosognosia or the lack of insight about the disease, and it also include executive functioning disorder or inability of memorizing and organizing thoughts. Uh, Classification of schizophrenia according to the DSM-5 would include hallucination, disorganized speech, and negative symptoms, and dysfunction in social or occupation in school, at work, interpersonal relation or self-care. Duration should be persist at least 6 months. The treatment would include antipsychotic or neuroleptic medications such as clozapine. Therapy would include cognitive behavioral therapy or the talk therapy. Now we're bipolar disorder. It is called the manic or depressive disorder characterized by unusual or dramatic shifts in mood, energy, and or activity levels, and ability to carry out day-to-day function. There are the manic episode, depressive episode, and the hypomanic. And the diagnosis is usually diagnosed in young people, but about 10% are diagnosed at or after age 50. Um, okay, so the next one will be the signs and symptoms. They usually have intense emotion. They have changes in sleep patterns and activity levels, unusual behaviors of manic or depressive episodes. In older patients, agitation and irritability during manic episodes are present during the manic episode rather than feeling high. So it is usually misdiagnosed with schizophrenia due to the psychotic symptoms with persons with episodes of mania and depression. In older persons, bipolar is difficult to diagnose as symptoms may be confused with other disorders like anxiety disorder, eating disorder, or substance abuse. Causes, they are the same, could be a damage to the brain tissue structures or chemicals, or genetics or family history. Pharmacological treatment will include mood stabilizers, antipsychotics, antidepressant, SSRI, the MAO inhibitors, and lithium, which is a mood stabilizer, is a drug of choice. People who cannot tolerate side effects of this medication are given bupropion. Other treatment will include the ECT or the electroconvulsive therapy. We also have the cognitive behavioral therapy, the family focus therapy, interprofessional and social rhythm, and psychoeducation. So usually we ask ourselves, did mental decline begin first, or did physical impairment lead to cognitive impairment? So the diagnosis and treatment of mental health in older adults is more complex than in young people due to aging, because people start to age or lose their cognitive abilities because of deterioration of brain structures, or it could be stem from or other physical problems. So when dealing with elders with mental health, it is important for nurses to have or utilize their assessment skills, know the medication, know about therapy, ECT, and educate the clients. Okay, so in behalf of Group 1, we would like to thank you for these learning abilities.